My name is Dr. Memory Joanna Muunda, and I'm from Namibia, and I work with the Ministry of Health and Social Services. I'm initially working at Onanjogwe Intermediate Hospital, which is based in the northern part of Namibia, and I've successfully completed my postgraduate diploma in dermatology in clinical practice with the Merck Foundation, and this one was specifically sponsored by the Merck Foundation Capacity Advancement Program. So it was a 12-month course from 2021 to 2022, successfully completed. So I have been working in a state hospital in the northern part of Namibia, as I said, and Onanjogwe is one of the referral hospitals, in the northern part of the country. And since it's a referral hospital, it caters for district hospitals, like about 5 of them, Enana or Congo, or Tsumeb, and Umthia, and other hospitals as well. And also in the same time, it caters for clinics or health centers, which are about 10 or 12 of clinics within the same region. So as a medical officer in the Department of Family Medicine, we normally or usually see clients, we prefer calling them clients, who seek dermatological conditions, and we don't have an established department of dermatology. But I took it upon myself and the rest of our department, the colleagues, that we are going to be able to see most of the dermatological cases instead of referring them, because we also have a limited number of dermatologists in the northern part catering for state patients. Overall, it was a 6-module course over the span of the 12 months. And I can say it was very intense, in a sense that you have to juggle between making sure you manage to do the assignments, you manage to post your daily work, and you still have to continue your daily activities at work. So, but however, it actually really opened up my view on dermatology and the clinical cases we've been seeing in dermatology. And I will actually also recommend this to other people. And actually I've recommended to one of the nurses who works in the district hospital, because most of the time they will refer patients, and I've actually recommended if she can take up the next program for the 2023-2024. And also I liked it in a sense that the lecturers were very interactive. Anytime you have a question, they were ready to answer. The interaction between even our colleagues, you get to learn more on when people are posting about the certain topics that we are discussing for the day. And overall, it's really, really good, apart from the intensity that if you have to juggle between work and doing the course itself. And the other thing is that the content was actually sufficient for introduction and for a diploma part. It's really sufficient because it gave us a way of managing and treatment of mainly the most common dermatological conditions we see in our settings. So I would definitely again recommend it to more people to do this. And if they can find more people to do this, even the nurses, the doctors, especially in the outskirts of the country, it will really make a difference. Since I'm a medical officer, initially I was a medical officer in the Onanjogwe Intermediate Hospital, but as of current, I'm enrolled at Kilimanjaro Christian Medical University and colleges, where I'm pursuing my master's in dermatology and venerology, and all thanks to Merck Foundation, in a sense that it really opened up my mind in that I actually want to do dermatology as a profession. And initially, we never, actually at a hospital, we don't have a clinic, a dermatology clinic or dermatologists. We only have about 2 or 3 who are serving for the state. And knowing that we don't have this dermatologists to cater for all these patients, at the Department of Family Medicine, we all came up together that, or at least on Wednesdays, every Wednesdays of the day of the week, I will see the dermatological cases. And it was a success. Like, we will send out letters to the clinics, we'll send out letters to the hospitals that on Wednesdays we are running a dermatology clinic, and I'll be seeing these patients instead of referring them. And with the help of other colleagues, I'll do some consultations. And actually it was more beneficial to the patients, because for them to be booked an appointment to see a dermatologist, it might take a while for them to be seen, or it's in a sense of that they don't have transport money to go to the facilities that have the dermatological doctors. It made that it would be easier if they are seen at one particular place, and we only have one day. It's one day, but it was a very hectic day because all the patients now understood that we have dermatology on Wednesdays, and they'll come in and we'll work even up to late in over hours. Lastly, I would like to thank the Merck Foundation for giving me this opportunity that I was able to pursue my diploma, and they've given me the insights to continue. I think what you are doing for the less or underdeveloped countries in Africa, it's really applaudable. And if you can continue to sponsor out more and more people and in more different category of courses, it will really make a difference, because it also boils to the fact that to go and specialize in these specific courses, it can be costly, but with the help of Merck Foundation, it made a difference personally in my life and in my colleagues' life that have taken up different courses. So thank you very much. I hope you really continue to sponsor people to do what they can do to help and assist the clients. We prefer calling them clients rather than patients. Continue assisting these clients to become better, and also the professions to upgrade personal development for their career-wise. And it actually makes a big difference, both to the clients, both to the nation as a whole, and both to the medical officers who are providing and the nurses who are providing these services. Please continue to sponsor more people all over in other parts of the country. And one thing is that maybe it's that if more people are aware of that you can sponsor them, the more people are actually ready to uptake and do these courses. Thank you very much.